My name is Megan. I'm 36 years old. I have a wonderful husband, a wonderful son, and 2 beagles. We discovered my son Robbie was diagnosed with hemophilia when he was 10 months old. This was after a series of really deep bruising, a lot of hematomas, and a lot of concern over where these bruises were coming from. Eventually, he did receive a really deep bruise on his bottom from his baby bath, and that was the catalyst that got us into the hospital really to get his blood work done. After multiple tests were completed, it was confirmed that Robbie had severe hemophilia type A. When we first found out Robbie was diagnosed with hemophilia, we were very scared, anxious, and nervous for what that was going to mean. Without having any family history, there was a lot of questions about what the future would look like for us. Robbie's hemophilia has had a big impact on his day-to-day life. We've noticed the biggest impacts have been in us just trying to make sure that we do everything we can to prevent as much bleeding episodes as possible, whether that's being careful through his environment or about the activities that he's going to be taking part in. So at this stage of Robbie's life, being 3 years old, there are not a lot of activities he's not able to take part in that his peers do. But also it's something that we're cognizant of to how much he's able to get involved and to which activity level he can participate. So we manage Robbie's hemophilia through prophylaxis treatment, which is a preventative treatment. So Robbie has a portacath in his chest, and he receives prophylaxis treatment every other day, as well as situational prophylaxis, which is if he will be taking part in an activity which has high activity levels, we will give him an extra treatment, or if he's had any bleeding episodes, he will require additional treatment over and above that as well. Robbie's understanding of hemophilia, we believe, is actually quite good. In a lot of ways, it's just his everyday normal. He was diagnosed at 10 months. It's really all he has ever known. I feel today about our son's hemophilia diagnosis that we are actually very blessed that he was diagnosed in the time of day that he was in 2016. We have a lot of treatment options available to us today that would not have been available in the past. However, there's still some guilt to be had when it comes to knowing that we've passed this on to him, or I've passed this on to him through genetics, and just worrying about preventing any pain or suffering, and really just making sure that he's going to be able to participate in all of the things he wants to do, whether that be sports or certain careers, or just making sure that he has a lot of choices available to him as he grows up. The advice I would give to another parent caring for a son or daughter with hemophilia is to slow down, take it easy on yourself, ask a lot of questions. It's okay to make mistakes, and your son or daughter knows that you love them.